We've got together our three correspondents who have been covering this: Byron Pitts, Dr. Jennifer Ashton, Jeff Glor. And Byron, I want to talk to you first because you've been to a lot of bad stuff. You've been to Iraq, you were at Katrina. Have you ever seen anything quite like this one?
Bob, not at all, in part because the death and destruction is so concentrated. Port-au-Prince is a city built for 400,000 people, but more than 2 million people live there. And it's not just Port-au-Prince. We were in a town about 15 miles outside of Port-au-Prince, closer to the epicenter. 100,000 people live there. 85% of the buildings were destroyed. There's a 500-year-old Catholic church gone. The coffin maker there was told, stop making coffins. There are too many bodies. Just wrap them up in towels and blankets and put them in a hole.
It's almost like Katrina without the high ground to go to. There's absolutely no place to go. Jennifer, you flew in, on Friday, I guess. You brought your own nurse with you. You came in with a group of doctors, mainly to just do doctor work and do some reporting on the side. This is extraordinary what's happening down there.
It really is, Bob. And on day 5 of this disaster, what we're seeing medically is the dehydration and the crush injuries really setting forth a scene of full-blown infection. We're seeing a lot of gangrene in limbs that have been crushed, necessitating almost hourly amputations. They don't even have enough bodies for the limbs that the doctors need to amputate to save these people's lives. So it is, and they're still pulling people out of rubble. Every once in a while there'll be a good story, but for the most part, patients in really critical condition.
And Jeff, this is really your first big story for CBS News, is it not?
Well, it was in Iraq, but this is certainly much worse than Iraq at the time when I was there. And Bob, there's really a story almost every couple hours when you're out in the streets. We talked to a woman yesterday who, when she heard the earthquake happen, she realized her daughter was in a school. She went there. Her daughter was pulled out. This woman held her daughter for 5 hours before her daughter died in her arms. This woman now, as we spoke to her, is lying on a bed. She is not physically in pain, but she is so racked with mental anguish that she cannot move. It is unforgettable to see some of the stories like this, and as I say, they are all over the place.
I want to go back to Jennifer. What is it like to try to give medical help to people under conditions like this? You're used to working in a hospital. You're used to antiseptics and all of the things that we come to associate with medicine. This is a whole different kind of deal.
Right, Bob. And on the one hand, it's gratifying because every single person we touch, we're really making a big difference for them. But as soon as we step away, we realize that we might have put a clean dressing on an open fracture and a severe wound, but they're not going to be able to get that dressing changed, and they're not going to be able to get the surgical care that they really need, that we really take for granted when you work in a hospital. So only the doctors and nurses who have had extensive combat medicine experience are ready for this. Otherwise, we're just trying to do the best we can, and it's very difficult.
How difficult, Byron Pitts, is it to report this story, to get your story out of there? I mean, you've been in some bad places, as we just said, but just the logistics of this are extraordinary.
Oh yeah, Bob. It's been far more difficult than the tsunami in Indonesia, any story I've been. For instance, when we first got here, there were no phone lines. The first night we reported here, it was difficult to do live television. You don't have access to your computer. I did a big piece that'll be on 60 Minutes tonight, a 12-minute piece. And we had to dictate the script over the phone because you don't have the technology that you would normally have to use computers. So this is a place, I mean, Haiti was a place that didn't have much before the earthquake. What little they had was taken away.
I mean, these poor people, as you say, you're starting at ground zero, below ground zero, on this. The city, although there have been incidents of violence and some looting, it's been remarkably quiet when you consider the fix that these people are in.
Oh, yeah. The people here, Bob, have a resilient spirit. I was at the General Hospital in Port-au-Prince the other night. It's the biggest hospital in this country. And the doctors there were using rusty hacksaws to amputate limbs. You could hear women and children moaning in the darkness. But at one point, it was close to midnight, at one point a woman started humming and then singing the Haitian national anthem. And then eventually you heard about 300 people, all wounded, singing their national anthem, which talks about pride and struggle. So if anyone in the world could manage this kind of disaster emotionally. Perhaps no one could do it better than the people of Haiti.
Let me ask Jennifer and Jeff. Jennifer, what is the one moment since you've been there that you will always remember?
I think, Bob, it had to be when a 15-year-old was pulled out of a building on the evening that we got here. So it was 3 days in, and she actually had to have her arm amputated to be pulled out from under a dead body. And about 4 doctors, 3 nurses took care of her, and we had to give her our clothing because she had nothing. And those rescuers saved her life, and she's actually going to make it. That probably will stay with me the most.
And Jeff, how about you?
Well, I would say a couple days ago, I spoke to a woman who had 3 young children, 3 daughters between the ages of 4 and 9. Her leg was badly damaged in the quake. She was in her house when this happened. She was cooking a meal for her kids when this happened. She now can't move. She is responsible for 3 children, 3 young girls. When I spoke to them 2 days after the quake happened, they still had not eaten or drank anything. She said to me that she was convinced at that point that her children would die. Can you imagine what she's going through right now? I asked her when this ends. She said it ends when God arrives. Well, it's tragic.
I want to thank all of you for the good work that you're doing. Be safe and keep up the good work.